All
Got
right.
it.
So, welcome, Dr. Cirillo. Thank you for speaking with us. We are very excited to have you to start off our advocacy series with our first Advocacy 101. So, thank you so much for coming.
It is my pleasure to be here, and I appreciate the invitation. So, I'm going to give you all a little perspective, and I'll talk to the crowd that's here tonight, but I also know it's being recorded. So I'll try to make the comments kind of relevant to all of you. So I interacted with Dr. Holly at the FSEP Symposium by the Sea, and I gave a talk about advocacy there, and then one of the other people that's involved with reimbursement in emergency medicine was giving a talk and was using lots of acronyms and lots of references to, some of the minutia around reimbursement and the politics around that and some federal laws. And Dr. Holly, being Dr. Holly, kind of raised her hand and said, "Time out. The residents and students here have no idea what you're talking about." And she was absolutely right. And it was a great call out. So as I go through this talk, for those of you who are seeing it live, if I reference something that you don't know what I'm talking about, please throw something in the chat. And Lexi has graciously agreed to monitor the chat. And if I need to be stopped, she'll stop. If there's a question that we want to do at the end, we can do that. My goal is to try and go through, I have some slides, is to go through those in about a half an hour and then leave time for us to talk about emergency medicine, what you want to know about it, and really answer any questions that I can answer for you. My background quickly is I did medical school at the University of Vermont. I did a year of internship at GW in DC, and then did my EM residency at UMass in Worcester, Massachusetts. Since that time, and I know it's hard for you to all believe, that those of you seeing me live, that I'm now in my 30th year of practice. But I finished residency in '94. I was an academic for a while. I did a rural single hospital place where we did 24-hour shifts for a while. I did work in the health department here in Rhode Island related to bioterrorism after 9/11. And then I really got more focused on what I do mostly today, I'm really full-time government affairs for my group, my company called US Acute Care Solutions. So I've been able to evolve my career to do what I'm passionate about, which is to work on issues that affect the entire specialty. And that's kind of who I am. At the same time, I kind of grew up within the House of Emergency Medicine. I was on the EMRA Board of Directors when I was a resident. So from 92 to 94, I was on the EMRA board as the ACEP representative, and then stayed active in ACEP my whole career, have been now on the ACEP board. This is my sixth year. So this is my last year on the board. And really has been my privilege and pleasure to work within the specialty, and particularly within ACEP, on trying to make practice better for all of us and to make a better future for all of you who end up going into emergency medicine. So that's kind of my background. And let me open up the slides, and let me do share screen, and let me go through the slides, and then we can have a conversation after that. So can you all see the slides, hopefully in the right format? Yep. Yes. Thumbs up.
Yes.
Okay. All right. So the value of advocacy really in your life, and the pretty trite saying is, if that you aren't at the table, you're on the menu. So my disclosures, as I just told you, I work for US Acute Care Solutions. I do government affairs for them. I still practice clinically a little bit, but gotta be honest with you, 30 years down the road, not as much as I used to. I will caution all of you starting in your career, don't blink, because you're going to blink and 30 years have gone by. I know that sounds kind of funny, but I can't believe I have to tell you, in disclosure, I'm 30 years out of residency, and it happens way too quickly. So don't blink. The three things I hope that you'll get out of this is, first of all, that you have an important role to play in shaping the future of healthcare, that you will do that by assessing the realities within which you have to work, right? Because the world is not fantasy land, and we don't get to make up the parameters in which we have to influence people. And then the third part is the how, right? So once you decide that you want to advocate and you understand some of the rules about it, how can you then be effective? And that's kind of some of the stuff I'd like you to take away here. I don't know how many of you know the movie The Monty Python and the Holy Grail, or the whole Monty Python genre of things. It's a very funny thing that was started by some British actors back years and years ago. But this is a Grail quest, right? Your whole career and advocacy is a Grail quest, right? It's a journey to try and accomplish something. And I want you to keep that in mind, because the journey, as most journeys always are, they're not a smooth and easy road. And you're going to go on a journey. This journey is about advocacy, and I use that word really deliberately, because advocacy is a noble passion, right? Advocacy, being an advocate, is trying to get others to understand how we can do things better, right? And nobody advocates for things that are already going well, right? We all focus on the things that are not going well, the places where there are challenges. And I would point out that, those four people that you see, right, those are advocates, who probably are the best examples of giving of yourself for the betterment of others. And if in life all you do is advocate for yourself, I guess you can do that, but that I think you lose some of the nobility, right? And you look at Mahatma Gandhi and Mother Teresa and Nelson Mandela and Martin Luther King, and you go, they gave and they did what they did because they were trying to make the world better for others. And I will tell you, don't ever lose sight of that, because advocacy on behalf of others is not only the right thing to do, but in a world sometimes where it's going to get hard. What we do in emergency medicine is really hard. And you're going to need to restore your own batteries. And doing on behalf of others is definitely a way to do that. And I use the word advocacy because people say, well, are you a lobbyist? And I go, well, nobody in the world ever grew up wanting to be a lobbyist, right? That's a dirty word, right? Lobbyist sounds bad. That's why I always use advocate. Advocate's a much better word, right? And part of this is, look, unless you're practicing somewhere where there's magical stuff where you can create your own reality, the reality is, in advocacy, you've got to say, well, where do I want to go? What do I want to accomplish? What do I want to fix? But where are we now, right? Because that journey of getting to something being better, you have to know where you're starting from. And so, for those of you who have seen The Matrix, the red pill, red pill, blue pill, look, you can continue to just kind of go about your day. But if you really want to change something, you've got to appreciate that there are realities. And I'm going to share with you some of those because this is the reality of how we make things better. First reality, nothing is going to stay the same, right? You are all in the infancy of your career, and you're learning new things every day. I will tell you, the world will continue to change, and I think you all know this. The rate of change has exponentially increased. So what you learn today as, the dogma of, microbiology, hey, by the way, 2 years ago, there was, 3 years ago, there was none of this COVID thing. There was no such thing as COVID. And all of a sudden, the microbiology of the world has changed dramatically. And if you don't believe that, you have to understand that, look at what's happened with RSV. Right? RSV used to be a disease only of little kids, right? Like nobody over the age of what, Robin, 3 got RSV, now we're talking about, wait a minute, why I'm 63 years old. Why do I have to get vaccinated against RSV? What the hell is that all about? So the world's going to continue to change. Here's another reality. This is the most well-intentioned, most naive sign I've ever seen, because as much as we don't want politics to be in healthcare, and I think we all would say that, and we all believe that, but that's not the way the world works. So there is going to be politics in healthcare. That makes it more challenging to fix healthcare and to get things better, but you have to acknowledge that there are politics to it. And the politics in this country, and again, I'm not going to tell you anything you don't feel every day, the politics in this country has gotten much more challenging. right? And social media is been the exponential gasoline on that fire because now in a millisecond, everybody has an opinion and everybody's an expert, and all they have to do is just post something somewhere, and they feel like they are entitled to be right, regardless of facts, regardless of science. It doesn't matter. And people have gotten into these echo chambers where if you go on certain social media platforms and on certain, certain apps, all you hear are people who agree with you. And I will offer to you, if there's one danger in life is if every day you just listen to people who already believe what you believe, how will you ever learn anything new tomorrow? Right? So I think for social media, I will give you that caution of, not everything you see on social media is real, even before chat and AI, chat GPT and AI. Now, boy, talk about verify your sources. That's gotten a lot more challenging. For those of you who are Jeopardy fans, I'll take people who are going to make big decisions about my future for $1,000, Ken. And if you don't know who all the people on this page are, that's okay, but you should, right? So we'll start from left to right. Obviously, my left to right, President Biden. Top next to him, Secretary Becerra, so Secretary of Health and Human Services, Secretary Becerra. Below him is the director of the Center for Medicaid and Medicare Services, Chiquita Brooks LaSure. These are people in the administration who are making decisions about regulations every day that affect whether or not you can take care of people and how you will do that, how you will document, whether or not you will get paid for that, whether or not you'll get sued for it. Those people are making decisions at an administrative regulatory level. The other four people, Senator Schumer, Senator McConnell, Representative Jeffries, and Representative Johnson, are the Senate and House leadership. They are affectionately, or sometimes not so affectionately, referred to as the four corners of Congress. They are making decisions every day. They are going to make decisions about all kinds of stuff coming up that are going to affect you and your patients today, tomorrow, 5, 10, 20, 30, 100 years from now. You have to acknowledge that those people exist and they wield the authority to make changes on your behalf. Your job is going to be, how do I influence and educate those people who are going to make those decisions? Or how do I become one of those decision makers? Right? But that reality of there are people making decisions, and that's at the federal level. Just remember, that's duplicated at the state level, county level, hospital level, every level. There are people making decisions. Our politics are, well, maybe not what we'd like them to be anymore, right? Do I personally believe, off the record, that Donald Trump and Joe Biden are the two best candidates we could find in this country to be president? I will plead the fifth. But you go, okay, so what's the reality? The reality is one of those two are likely to be president again come the end of 24. That's a reality. Now, I apologize to anybody who's either from the St. Louis area or from a Cardinals fan. But when we start talking about, okay, who are our constituents and who are our peers and who's like if you're going to hold up this sign and you haven't done spell check, that's a problem, right? And my analogy is in some ways, like it or not, we have become the Jerry Springer nation, right? And we have people who would sell their soul, and God rest Jerry Springer, who died, in 23, but who would sell their soul to have their 15 minutes of infamy and shame on the Jerry Springer show. Is that good or bad? I don't know, but it is, right? I mean, as you take care of people in the emergency department, not everybody, I think, meets the prudent layperson standard. And I'm pretty sure that anybody whose clinical history starts with, hey, hold my beer, watch this, probably doesn't meet the prudent layperson standard, but we're going to take care of them anyway. Here's another reality. Healthcare involves money. I know that sounds terrible, but healthcare represents 18% of the gross domestic product of this country. There are billions of dollars spent every year on healthcare in this country. Whether we like that or not, whether we think there's enough dollars or not enough dollars, or they're being spent the right way or wrong way, there's a lot of dollars, which means a lot of people want their hand in this game. the projection for how much we're going to spend on healthcare continues to go up. So the projection is within a few years, we'll be well beyond 18% of gross domestic product. That means we'll get to the 1 out of every $5 spent in this country is spent on healthcare. The money people, the business people are well aware of those numbers. And when you look at what we spend in this country, we spend way more on healthcare than other, economically advantaged, whatever kind of countries you want to call them. Is that too much, too little? I don't know. We're different, right? We clearly are different. Here's the other reality. As those numbers that you saw are going to get worse, and I'm going to make them worse because I'm part of this thing called the baby boom. And there are now 10,000 Americans, 10,000 every day, that are reaching the age of 65. Okay, and when they reach 65, they go on Medicare, right? And Medicare is funded how? Primarily through tax dollars, right? There's a Medicare payroll tax that all of you who are employed pay, and your employer pays as well. So most of Medicare is funded through payroll tax and general revenue, which means comes out of your income tax. So that's part of the challenge. When you look at the numbers, right? And these are projections. This slide on the left is from the Kaiser Family Foundation. I'm going to talk about them. We're in 2023, 24 now, right? So we're halfway between this 56 and 73 million. But look at that jump in this, by the end of this decade, having 73 million people in America out of 350. So almost more than 1 out of 5 on Medicare. And then look at the ages, right? We're keeping people alive longer. So if you think about it, it's not just somebody who got Medicare and, gets off of Medicare at 67, which, by the way, in 1965, when Medicare was created, and Medicare, the benefits started at age 65, what was the average life expectancy of Americans at that time? And the answer is 67 years. So Congress created this great program thinking, hey, this sounds great. Like, we'll tell them we'll give them free health care once they turn 65, because statistically, they'll all be dead by 67. So we only got to cover 2 years. And by the way, back in 1965, you got like penicillin and an x-ray, and that was pretty much all we had, right? Not so much anymore. And so all of a sudden you go, well, wait a minute, if we keep people alive until they're 90, well, who's paying for that? That slide on the left would be challenging enough, but the slide on the right makes it doubly challenging, which is the number of people in the workforce who are paying Medicare payroll tax, that the slope of those two curves is exactly opposite. And so you're having more people in the system at the same time, you're having less people paying into the system. So what does that mean? It means you're all going to have to work really hard. What it doesn't mean is this. I'm not advocating for death panels. I'm not. Although I will make the observation, that guy playing the guitar is not exactly rocking the house right now, is he? And if you ask that woman in the green, yellow dress if she'd rather be part of the, on the death panel list or listen to him play any longer, I don't know. She might pick option A. And just keep in mind, when people hit 65, they're going to want things like scooters. And just so you know, I don't want that scooter. I want this kind of scooter. Just so you know, I'm not going for the basic model. So you're going to have to work a lot harder. Here's the other reality is when you start to have a lot of money, you get some bad actors in the game. And apologies to any of you who are Nick Cage fans. But I will offer to you my perspective. The bad actors are these people. The insurance companies, particularly healthcare insurers in this country, just remember, they start out getting all the money, right? They get all the premiums from insurers and from people like us who pay, part of our hard-earned dollars as healthcare premiums and co-pays and cost shares and stuff like that. And then they decide whether you providing care to a patient at the bedside are going to get paid or not. They really do. And they have all the advantage. They have all the money and they have all the data. If you want these are actual clippings from, like Becker's or Modern Healthcare, companies like United Health are posting quarterly profits of over $5 billion. $5 billion in quarterly profits. And remember, United Health Group, maybe you do or not know this, that Optum that's referenced in there, Optum is their offshoot physician or medical practice. And United Health Group, the largest insurer in this country, now employs 90,000 physicians. They employ more physicians than anybody else on the planet. So if you want to talk about what keeps me awake at night and what I worry about is I worry that we as physicians are not losing control internally, we're losing control externally. And this issue of vertical integration where you have companies like Aetna, that's a healthcare insurer, now part of the same company as CVS, which does not only the pharmacy, but they do Minute Clinic and Health Hub and lots of other direct healthcare. So you have one entity that's the insurer deciding whether to pay for healthcare services. At the same time, they're employing the providers. And oh, by the way, they own the pharmacy and the PBM. It's interesting as you hear about consolidation in healthcare, and you hear now about the administration kind of getting more involved about physician consolidation. I want to know, where was the Federal Trade Commission, the FTC, and the Department of Justice when this all happened? Because I don't remember them saying that this consolidation was a problem. And yet this is the consolidation that basically places us out of the market of being able to really negotiate to stay independent and autonomous.
Dr. Cirillo,
Yo.
could you go over what a PBM is?
Yeah, sorry. So a pharmacy benefit manager. So think about insurers are the middle people between employers and people like you and I who need healthcare, right? Not on the provider side, but on the human being side, right? So insurers are they basically take in premium money, and then they are responsible for paying for the healthcare on behalf of things like, employers. Or anybody who buys healthcare, right? You pay a premium, you expect to get healthcare benefits. The pharmacy benefit, the PBMs, are these intermediaries that were created honestly to siphon more money out of the system. So a pharmacy benefit manager is somebody like Express Scripts would tell a company, well, we'll manage your pharmacy, the needs of your people from a pharmacy perspective. And then what they would do is they will then work with the drug manufacturers, and they get like, I don't want to say kickbacks, but yeah, kickbacks. So if they put a certain drug on the formulary, they get money from that pharmaceutical manufacturer. So these PBMs became brokers of what's going to be on a formulary that you can then prescribe or not prescribe based upon somebody's insurance coverage, their plan. And then they started siphoning more money out just for doing that. So anytime you create another layer of somebody in the middle of this, they are trying to take money out of the system that doesn't go to providing healthcare. So that's what a PBM is. And if you pay attention, Congress is now very much unhappy with PBMs because basically they've just been siphoning money out of the game. And when you look at something, you look here, you go, well, every one of these insurers, United, Aetna, Cigna, Anthem, Humana, Blue Cross, they all had a PBM. So they were triple dipping, right? Not only were they making money on the drugs, but they were making money on the processing, the wholesaling of the drugs at the same time. So again, smart business people who could find ways to pull more money out of the healthcare system that doesn't go to you as a provider or directly benefit the patient. Busy slide. I just want to point out to you, if you look at this slide, this is not about healthcare insurers, but if you look back here to the left of the slide, I want you to just look at these 4 insurance companies: State Farm, Allstate, Geico, and Progressive. Have you heard those names? You go, yeah, I see commercials for them all the time, right? State Farm is the, Jake from State Farm, right? Allstate, that's the guy the chaos, the mayhem guy, right? Geico is that's the little lizard, right? The gecko. And Progressive is Flo, right? So these very well. Why? Because they advertise like crazy. Well, where do you think that money comes from, by the way? And look at when these companies were founded. 1922, 1931, 1936, 1930. Boy, it sounds like they have a pretty successful business model selling insurance, don't you think? They seem to have done fairly well. And my point here is that as insurers consolidate, and these are healthcare insurers that have consolidated, every little black dot has now been consolidated into these much fewer in number. So you look at United Health Group, Centene, Kaiser, Blue Cross, Anthem, Aetna, WellCare, and Humana. There's only literally less than two handfuls of healthcare insurers. So they have consolidated to the point where they have increased their ability to leverage their size, and then they just take more money out of the system because you as a single provider, in an independent practice, how are you going to negotiate with Blue Cross? You don't. They basically tell you, here's what we'll pay you. So consolidation of insurers has driven a lot of the economics of healthcare delivery. And the other problem with insurers is they have an army of zombie lobbyists. They spend more money on lobbyists than you and I could ever imagine. Blue Cross spent over $20 million on lobbying just at the federal government level in 2023. And they are innumerable and they never stop. That's their only job, is to try and change the system to take more money out of the system. And that's a reality that we're fighting against. I know I'm going to give, I know it's coming. Tell me, you're like, really? So why am I going to go to medical school here? Like, when is the happy news come? Within emergency medicine and medicine, we've got a lot of different things to talk about and a lot of things to worry about or things to work on. Telehealth, scope of practice, AI, corporatization, reimbursement, medical malpractice. There's always going to be issues. On a clinical side, we have issues as well. And particularly for emergency medicine, we talk about issues of crowding and boarding, right? And we've had crowding for, I don't know, as long as I've been, in healthcare. It feels worse today. I don't know that it is worse, but it certainly feels worse. And, I love this slide. I want to know where this is, because what I really want to know is, if you look, how are they going to get another patient on that empty stretcher? First of all, the fact that there's an empty stretcher is amazing. And then how the hell would you ever get a patient there? Like, they'd have to hurdle to get there. We've got issues still of substance use disorder. We're still losing way too many people. We have issues of violence in healthcare. And I shared with some earlier in the call, we have issues about, mental health and mental illness, and particularly pediatric mental illness. Boy, we've got a ton of work to do there. I will tell you, every day when I do advocacy, I feel like I'm Sisyphus and pushing the rock back up the hill. And usually at this point where people go, okay, I'm really depressed, I go, well, maybe I don't have a sponsor for this talk, but if I did, it would probably be ketamine. That probably would be a good thing to, take a 5-minute intermission here at this point. So why do you have to do all of this? I already kind of told you, decisions are being made every day at the federal level, state level, hospital level, and even in your community, right? So there are decisions that are going to be made that will influence what you do and how your world and your career is. This is from Simon Sinek. When you're going to talk about the 3 questions about why we do something or how we do something or what we do, the most important question is the why, right? What is your why? What is the thing that you're most passionate about? And everybody's got something that they're really passionate about, right? So here's the Muppets. And, number of years ago, Mitt Romney was running for president, and he wanted to cut PBS funding. And I'm like, the Muppets just said, okay, Mitch, let's go. Shit just got real. Bring it. Right. So there's always something that is going to be your issue. And I shared, I think, with Lexi and Kelsey earlier, you can't fix everything in this world. There are too many problems to fix. So you got to find the one that you care the most about. And that's what you're going to focus on. Now, I'm going to take a moment of editorial personal privilege here. The slide on the left is falling on your sword, right? In politics and in advocacy, that's not what we're talking about. I hear people use that as opposed to your hill to die on. I want you to identify your why and the hill you want to die on if you've got to die on a hill. Falling on your sword is when you do something wrong and you have to kamikaze, you have to, not kamikaze, what's the word? Help me. Japanese. When you take your own life after you screwed up. What's the word? Oh, Starbucks gift card to anybody who can save me here. Harry-carry, when you commit harry-carry. So falling on your sword is when you commit harry-carry, when you want to admit you did something wrong or failed. That's not what we talk about here. We talk about choosing the hill you want to die on. And I want you to all to believe that as you grow in your career, your spheres of influence will continue to grow. The slide on the right shows what people in this country believe about the honesty and ethics of different professions. And historically, and on a repeated basis, nurses end up number one, which is a political reality we got to deal with when we talk about scope of practice, by the way. But doctors come in second. And so you do have instant cred. You have cred just being in medical school. You have cred when you tell people I'm studying to be a physician. And if you want to get out of the angst of, well, who's calling themselves a doctor? I have no angst about that. I just tell them I'm a physician. I don't, there's lots of doctors in this country. There's doctors of music, there's doctors of everything, but there's only physicians who are healers. And so I don't get all bent out of shape when people call themselves a doctor. I just say to them, and I say to people, well, I'm a physician. Are they a physician? And then they usually kind of look at me and go, well, they said they were a doctor. And that's when I'll say to them, well, that doesn't mean they're a physician. And then they're like, oh, so you are going to have a bigger ripple effect as you progress in your career, but your voice matters and people respect you already. And so don't discount that. I will share with you, you are not, if you choose to go into emergency medicine, you are not going to be part of the happy dermatology practice, right? Which I think should be the name of every dermatology practice, because like it's Monday to whenever we want to work, and all we do is make money and, do punch biopsies. Emergency medicine's really hard, right? You are going to work nights, weekends, half the nights, weekends, and holidays. You're going to miss important family and friend events. You're going to be exhausted at times. You're going to be overwhelmed every day when you walk into the ED, or the ED is chaos every day. That's the original ER show back in the day. And I will kid you that people used to say to me, hey, you look just like that guy on ER. And I would go, I look just like George Clooney. And they would go, no, the other guy. And I'd go, okay, thanks. And in the end, when the life went out of him and my hands could work no more, I left from that place into the night and wept for myself, for life, for the tragedy of death's coming. Then I rose and, walking back to the suffering house, forgot again about my own wounds for the sake of healing theirs. That's an actual picture of an ER doc who left after a failed pediatric resuscitation. Somebody took a picture. When you tell people, well, and they say, well, what do you do in that situation? You go, well, I go and I pick up the next chart. And they go, you can't possibly do that. How are you not, like, how do you heal you? Like, how do you deal with that? You go, I can't, I deal with it by picking up the next chart. And people go, that's crazy. No, that's not how people, and you go, I hear you, but that's what we do, right? So part of this is the acknowledgement that what we do can be exhilarating and exasperating from one chart to the next, right? And to me, that's kind of the reason why I went into emergency medicine. There's highs and lows, and they are big highs and big lows. I would offer to you, as we talk about all of this chaos and how hard it is, and no one can take away from you what I call the restorative moment. And that moment is when you walk into a patient's room, and I would encourage you to sit down and hold their hand and say to them, how can I help you today? At that moment, they may or may not be receptive to that. And you can't control what happens outside of that room and the chaos of documentation and all the other noise outside should end inside of you. Because at that point, you determine how you are going to be present in that room, and you determine whether you're going to be truly present for that patient and you're going to offer to heal them. They may not have anything physically that you need to heal. What they have may be very simple. They may be there because their dog told them to come that day. So what? They are there. And at that moment, you get to be a healer on your terms. And nobody can take that away from you if you let them, unless you let them. Nobody but you owns that moment. And that's the moment that when I walk out of that room and I know I was the best person I could be with another human being who just trusted me, maybe with their life. Although I'm a complete and total stranger to them, they are going to entrust their life to you on their worst day at their worst moment. But that's pretty humbling if you don't lose sight of that. So don't lose sight of that. So what do I want you to do? First of all, hope is not a plan. So I'm going to just tell you, you don't have to know this advocacy cycle, but there is a process of how to be successful in advocacy. Like there's a process for everything else, right? If you're going to put a central line in, you got to follow the path and right. And you'll be successful, hopefully all the time. Let's not go there. But there's a process. With every issue, you're going to have people who are for and against the issue. If everybody was already lined up, we wouldn't need to do advocacy. It'd already be fixed. So I'm going to share with you that you got to know who's in the game. And if there are players that are going to play, just know there are going to be haters that are going to hate, right? And I share this because people who are passionate can be a positive force or a negative force. And my analogy to you is any of you have ever had any home remodeling done, demoing your kitchen takes one day. They can destroy your kitchen in one day with a couple of sledgehammers. Rebuilding something takes patience, perseverance, takes dedication, takes some skill. And so when you see that something's broken, just know breaking it's easy. And there are people who want to just tear stuff down. That doesn't make anything better. Pointing out that something's broken or that maybe somebody else has failed, great. Thanks for that. How are you contributing to making it better? And I would offer to you that clearly one way you can do that is through being aligned with other people who are your peeps, right? And I'm an ASAP homer. I have always been. I'm an EMRA homer. But if you're an osteopath, ACOEP, if that's your niche, if that's the peeps you want to hang with, that's great. For those of you who want to be in academics, there's CORD, SAEM, the academic chairs. But honestly, the one thing we can't do is if you look at this, that where is the strength of all of these? In the middle. And I will offer to you, just like the Power Rangers were not the most, I don't really think I'd be afraid of fighting any of them individually, but it was when the Power Rangers came together, right? When we bring our voices together and we advocate together and collaborate and find common ground, that we can be much more powerful. There are times, I know this is hard. Some of you are going to have to sit down. You may not be the smartest person in every room. I know that may come as a shock to some of you. But believe it or not, it's not about being the smartest person in the room. It's about finding ways for everybody to feel like they are the smartest person in the room. And if you don't believe that, you might believe this Einstein guy who was once asked what it felt to be like the smartest man alive. And his answer was, I don't know. You'll have to ask Nikola Tesla. Right? Because if you look at those list of qualities on the left, I'm going to tell you personally, I think the most important quality to be a successful advocate is the book on the bottom, which is humility. Because if you go in believing you know everything and you're right, and you just want to tell people that, will you be a successful advocate? I don't think so. Right? And part of this is you've got to find solutions that are the win for everybody. Because if you create winners and losers, you inevitably have created tension and discomfort that somebody's going to come back and go, well, I lost this time, but I'm not done. I'm going to go back and I'll fight again next session, right? So think about finding the wins, win-win. So here's the 3 things you have to do. You have to educate yourself. And I put up the Kaiser Family Foundation because if you know nothing about health policy and you want to go to one website, you go to kff.org. The Kaiser Family Foundation is a nonpartisan health policy think tank that publish stuff on all kinds of health policy topics, Medicare, Medicaid, anything you want to know about healthcare policy. If you want to find the primer or find some basic stuff, go to kff.org. They do great primers. They have a 4-page primer on Medicare that if you read that 4-page primer, you will know about Medicare than more than 99.9% of the people in this country in 4 pages. Right? You have to participate, right? If you don't show up, you don't ever get anybody to believe you really care about the issue. And the last thing is you have to be willing to contribute. And contributions come in let me go back for a second. But contributions mean that you have to put some skin in the game. Yes, you're going to have to protest this shit more than once. Just so you know, again, if it was easy, every issue would be fixed. And so there are issues. Advocacy can take years and years and years. Within the House of Medicine, there was a program called the Sustainable Growth Rate Program in the Center for Medicare and Medicaid about how physicians were getting paid by Medicare. That program was flawed from day one. It took us 14 years of advocacy, every year going to Capitol Hill as part of the ACEP delegation saying, this is broken, you got to fix this. 14 years it took before Congress changed it. If we had given up in year one, they would have never changed it. But sometimes you got to stay in the game. You can participate in different ways. Go testify on a bill. You can be active on social media, but again, I would put the little caution symbol up about the value of social media and particularly the validity of social media. Do not believe everything you read. It is not all true. It is people voicing opinion based upon what they want you to believe. The awareness ribbons. I want to share with you that one of the ways that you can very visibly let somebody know what you care about is wear a ribbon, wear a pin, right? How do I know that you care about, what's the ribbon for breast cancer? What's the color? Everybody knows it's pink, right? The whole world knows it's pink. The whole planet knows it's pink, right? If you're wearing a pink ribbon, people pretty much immediately know you probably have some passion about breast cancer care. Wear your ribbon or your pin about whatever you care, because maybe people don't know what the pin is about. If nothing else, they'll ask you, hey, I don't know what the brown pin, what is that for? And you'll say to them, well, it's about X. And they'll go, I didn't know that. And if they're truly genuine, they'll say, well, what's your connection? Why do you care? And then you get to tell a story. And when you tell that story, that person might go, oh, I had no idea how much of a problem that was. Boy, well, can I help in any way? Now you have another advocate. Or somebody's going to go, hey, you're wearing the brown pin. Yeah, I had a family member with that too. What are you doing? Did you know there's a group of us, right? So being very visible about what you care about gives people that invitation to ask you about it. You can at some point become part of the solution. Remember all those people that we said are decision makers. Right now, there are 4 emergency physicians in the United States Congress. Raul Ruiz, Rich McCormick, Mark Green, Ronnie Jackson, and Mark Green. So we have 4 emergency physicians, more than any other specialty currently in the US Congress. So out of the 435 members of the House, we have 4 emergency physicians. We have emergency physicians like Amish Shah holding the microphone, who's a state rep in Arizona running for the US House. We have docs like Arvind Venkat, who's the only physician in the Pennsylvania legislature and the first physician in 60 years. 60 years, there has not been a physician in the Pennsylvania legislature. And these people are making decisions about what every day? Oh yeah, healthcare. Deb Oury Rich, I forget his last name. Don't hold that against me. Are part of the administration. Deb is the chief medical officer for the CDC. Ann Zink and Steve Sack are the state health directors for the states of Alaska and Kentucky. So you can be these people. These are careers, these are positions waiting for you. I'm in the home stretch here. The most important thing about advocacy is building relationships. And I want you to think about that across your entire life. And most successful relationships, think about your personal relationships. And I'll ask you the question, do your relationships that last start with, hey, I want something from you? In most cases, if that's the first thing you say to a potential partner in any relationship, they're going to go, wow, really, I want. First thing I say is I want. In every relationship, you should be building upon, how can I make you better? How can I make you happier? How can I help you in what you care about? And so relationship building with stakeholders, relationship building with policymakers has to be built upon, how can I help you? And I want you to think about being a member of Congress for a minute. And I want you to think about how challenged they are. They're going to vote on funding NASA. They're going to vote on reforming healthcare, and they're going to vote on naming a post office all in the same day. How the hell do you think they're experts on all of those? And the answer is they're not. And a member of the US House has 4 or 5 staff people, and that includes like the receptionist. So they've got a chief of staff, they may have a director of a legislative director, and then they have 2 health LAs, legislative assistants, where they divvy up the entire planet. Like, really? And those people, just so you know, those health LAs, do you know how old they are? They are in the range of 25 years old. They've all just graduated from GW or Georgetown or American University, and they all think they're going to be president someday, just so you know. Those people, those 25-year-olds, are telling the members of Congress, here's how you should vote on this issue. So if I'm going to build a relationship, I'm going to build a relationship with a 25-year-old, not in a creepy kind of way, but in a advocacy kind of way, because they're going to be involved in making decisions in DC a lot longer than that member of Congress is. So one of the lessons here is be nice to the staff people. Those are the people who are really running the show. Members of Congress come and go. Those staffers stay around for a long time. And the two things that you have to decide you're going to give are time and money. Those are the two currencies. Those are the coins of the realm in advocacy. The money part everybody hates, and it ain't going away anytime soon. That's another reality. So I know we can all do this frowny face, but you can say that, but we got to deal with that. So just keep in mind, those are the two currencies of the realm. Final points. You matter and your voice matters, right? You got to fight because this is your future, right? Again, I'm on the way down side of the mountain here. My mission now is to make sure that you all get in the fight because this is your future, and sitting back and being disappointed is on you now. And I'm going to say to you, disappointment or unhappiness is the delta between expectation and reality. So first of all, you know those realities I told you about, you better set your expectations based on those, because not for nothing, if you think you're going to work 50 hours a month and you're going to make $500,000 a year to ski in Denver as your career, let me know. Good luck. If you find that job, I'd like part of that. But that's not reality, right? So you better have the right expectations. Every day in the ED is going to be hard. Some days are hard in different ways, but they're all going to be hard, right? There's no easy days. They're going to be hard days. They're all fulfilling if you let them be, if you make them that way, but they're hard. But this is your fight. And that fight starts today, right? And you kids, I don't want to hear, well, I'm only a student. I'm not even sure if I'm going to, I don't like, this is your future. And there are people making decisions tomorrow. So you got to get in the fight today. And with that, I'm going to stop sharing my screen so we can have a conversation about whatever you want. And just, I do not have a hard stop at the bottom of the hour. So, if you all do, that's fine. But I'm happy to chat with you all about whatever you want to talk about.
Thank you so much. My question to you is, at the beginning of your career, did you always know you wanted to be involved in this, or how did you first get started down the pathway?
Yeah, I was one of those geeks, and in high school I was, I wanted to be involved in student government, and I was, patrol leader in the Boy Scouts. Yeah, I did all that stuff. Yeah. I think for all of us, and again, I think I want you all to feel comfortable acknowledging that, if you're in medical school, you've got a skill set, right? You've got a brain, right? You've been successful through school so far. You're going to be successful getting through medical school. There's a responsibility. It's kind of, for those of you who are, MCU fans, right? Peter Parker, with great power comes great responsibility. Well, look, the healthcare system it affects everybody in our sphere. You, family, loved ones, friends, right? Healthcare is the one thing that affects everybody. So if you, being in the unique role that you're going to be in as a physician, if you don't take some ownership of changing stuff for the better, then don't bitch when things go wrong, right? This is up to us. It's up to you. So the answer is, like, if you got to this point, whether or not you were one of the people who thought advocacy was going to be part of your life, I want to challenge you that it is. And that even if you don't think you're good at it, I'm not good at a lot of things. But that doesn't mean I'm not responsible for working at it. And there are people like me. I want to reassure you, there are people like me within every specialty, whether it's emergency medicine or not, who understand the importance and are advocates like I am. And so if you need a mentor, if you need mentorship, if you need someone to help you understand how to do this, you all will have my email and cell phone number. Please feel free to reach out. And if you just say, hey, can you hook me up with, and I could name 20 people in the FSEP chapter that I could connect you with in a heartbeat, who are absolutely looking for people like you who go, I get it, I want in, right? I want to be part of the process. So yes, we are waiting for you to let us know you're interested.
So to sum up some local resources for students who are very interested, or maybe not all local, but bringing up the Kaiser Foundation is brilliant. If you've never perused their website before, please do so. An amazing repository for so much data about the United States over the last decades, as well as, like you said, primers on scenarios that are very difficult, very large and unwieldy to understand, beautifully put together, and appropriate for most levels of entryway understanding. The other resource that we have, like Dr. Cirillo was saying, are people in our FSEP chapter in Florida, and students are welcome to listen in on the Governmental Affairs Committee meeting quarterly. So if any student is interested in that, they can DM us. We're going to post this on our Instagram account. They can DM us, excuse me, and we'll hook you up with that information. The third resource and experience that can be very, very important, and you do not have to know much about advocacy to participate, is EM Days, which is our days, 2 days a year to spend in Tallahassee. And we discuss current issues and visit different legislators. And you're a part of a team. As a student, you're incorporated. And you're actually a voice that the leaders of the Senate and the House really actually want to hear. And that experience was my first experience witnessing advocacy and the whole process. And it does change the way you look at how healthcare is decided in our country. And it really does help bring you to an understanding of the situation and perhaps your responsibility to your own future and the up and coming future. So I really, 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 really appreciate your time. I see the
Hang on, I'm pulling up the EM Day, the FSEP EM Days link,
perfect.
because I will be there, and any of you that show up, I will be happy to sit down with you. We will connect you with all the leaders within FSEP. And doing legislator visits is like doing any other procedure. You got to see one, you get to do one, and then you get to teach one after that. We will demystify it for you. Just keep in mind all of those legislators, and we kind of do the, oh my God, they're a state, whatever. They're terrified of what they don't know. Your job is to become their kff.org. Your job is to become their go-to resource as you build that relationship, so that when something comes up and they go, I don't know anything, what the hell is this all about? You want them to be DMing you about, help me understand this. And I will tell you, I had that experience. I was in Annapolis again Monday and Tuesday, and I met the woman who's the chair of their house. They're called delegates in Maryland on the House side, the chair of the health committee on the House side, and met with her a couple of times, went to a fundraiser for her, and then sat down with her on Tuesday afternoon. And at the end of that meeting, I said, well, first of all, I said, well, how can we help you? I didn't ask for anything. I said, what is it that you're working on that we can help you with? That was what I offered to her. But at the end of that, she said, we're coming out with a report on ED wait times here in Maryland because we think they're terrible. And her closing comment to me was, when that report comes out, please read it and tell me what you think we should do, because I want to make sure we get it right. I want to make sure we do the things that you believe will make a difference. And at that point, I knew I had won as an advocate, because she now wants me to tell her what it is to do. That's the ultimate win, is when those stakeholders now identify you as their trusted resource. That's what you're shooting for. So, yeah. So January, what is it, 29th, 30th, 31st. Even if you can come for one day, come for one day. we'll make it worth the drive up from Orlando or wherever you are. But it's a great opportunity to get directly engaged in all of this stuff. Cool.
Thank you again so much.
Yep. Robin, thank you. Lexi, Kelsey, Maria, Tareem, thank you very much for the opportunity. Please let your classmates know that, that the video, whatever the recording's there. Also tell them, even if they weren't on, I'm happy if they reach out to talk with any of them about what they want to do to have, have a chat.
Thank you.